everyone, my name is Ceres Valentin Bermudez, and today I will be presenting symptoms and treatments for hypochondriasis. Can you imagine waking up every day? Instead of thinking how wonderful the day will be, you think, I have a life-threatening disease? Being perfectly fine. Well, that has a name. We might think that this is uncommon, but the reality is more common than it seems. We all have a risk of experiencing hypochondriasis. As a dedicated student, I conducted a research using scientific publications to be well prepared to provide this valuable information on the topic. For that reason, I will explain the symptoms of this disorder and then elaborate on the treatments. The first point I will explain today is what are the prevalent symptoms of hypochondriasis. Have you ever felt anxious about your health? And if you have, to what point? Well, to understand all of the following symptoms, we need to know what hypochondriasis is. This is also known as illness anxiety disorder. It's a preoccupation or persistent fears about the chance of having or developing one or more serious, progressive, or life-threatening disease. Patients dealing with this disorder often exhibit symptoms such as chronic fear of illness. This is a long-term fear of having a serious illness. This can happen even in the absence of any concrete medical diagnosis. Frequent medical visits. They tend to go through medical consultations and frequently visit healthcare professionals, sometimes even for minor imagined symptoms. Excessive internet research. They spend an excessive amount of time researching symptoms and diseases. This usually increases their anxiety due to the misinterpretation of symptoms and exposure to alarming diseases. Exaggerate certain bodily discomforts. They tend to magnify normal bodily sensations, perceiving them as an indication they have a serious disease. For example, a mild headache might be interpreted as a brain tumor. Potential for depression. The constant fear of having an illness can lead to feel low mood, sadness, hopeless, constant stress, leading to depression. According to a study done by CertaPet, a 73.45% of Americans search for mild symptoms causes on the internet. In women, a 53.9% is very likely, a 29.1% is likely, a 40.3% is unlikely, and a 2.7% is very unlikely. On the other hand, a 22.9% of men is very likely to search the symptoms on the internet. A 41.4% is likely, a 23.6% is unlikely, and a 12.1% is very unlikely. After seeing the symptoms, it is crucial to explore how individuals can improve their lives. The second point I will discuss is the diverse range of treatments for addressing hypochondriasis. Learning about hypochondriasis treatment isn't just the knowledge, it's about having the tools to support others facing this disorder. Some of the treatments are drugs. Drugs is not the most common treatments, only in the cases where the patient has depression is given. They usually are antidepressants, like Prozac and Luvox. Psychological therapy. This therapy helps the individual to become aware of his way of thinking and how it affects his life. Cognitive behavior therapy. This consists of thought therapy. The patient talks about thoughts, feelings, their stress, among others. This changes the way they perceive a particular situation and how they react. Change lifestyle. Starting to exercise or engaging in a hobby helps patients to not focus on what they might have. According to a questionnaire done by Stuff That Works, demonstrates that hypochondriacs have tried usually more than 3 to 4 treatments. For non-drug treatments, a total of 23% try psychological therapy, 21% for cognitive behavior therapy, a 10% medication, and 9% other treatments, like change in routine, yoga, and exercise. To conclude, hypochondriasis is an anxiety disorder. The prevalent symptoms and the available of treatments are important to understand this disorder. We have seen the importance of knowing the symptoms of hypochondriasis and the treatments that are available. By understanding hypochondriasis today, we need to break the stigma around mental health. Like Marie von Ebner said, the incurable ills are the imaginary ills. Here are the references. And thank you for your attention.